Hello, everyone. I see I was late a little bit, maybe 1 minute. People are starting to come in. Let's wait a few minutes till more people start coming in, and then we'll start. Remember, start chatting with me. Don't be shy, just like the webinar here says. Message me, tell me who you are, where you're from. Remember to ask me questions while we're going along, and I'll answer them, as many as I can, at the end. Okay, so today we will be talking about the holistic approach around the dental program. This is one of the most overlooked program, and yet it's one of the most important things to address when working with our device. And I'll show you why tonight. First of all, we know that there is an energetic relationship between the teeth and our body. So when we're dealing with pain, infections, it's really, really important to start working with the teeth programs. Many of the issues of pain start from here, from TMJ. This is one of the most tense places when we have stress. It's one of the most tense places. And the muscles here of the jaw are directly related to all the nerves, muscles, and vertebrae, of the entire body. So that's why TMJ is often called the imposter disease, because many times people have digestive issues, knee problems, pain in their elbows, in their arms, in their neck, in their vertebrae, and it all starts from here. So when a person comes to you, it's very, very important to start with these programs, and I'll show you how. So let's start. Let me share my screen with you. Okay, and we'll go to our program. Here we are. Okay, before I go to the dental program, we can also see items from the main matrix. And it's funny because the first thing that comes up to me is TMJ. It's probably because I wanted to talk about it and it came up. It's so funny. That's why a lot of times they say before you do testing, don't talk or don't think about anything, because whatever you think about, that's the first thing that'll come up. Okay, so in the main matrix, we can see here from the subfilters on the side, dental isodes and dental nosodes. Okay, so isodes are, foreign, things that we put in the dental, the fillings, the whatever foreign things that we use from toothpaste, chemicals, and all sorts of stuff. So we can see immediately what reactions someone may have, what they may be allergic to, or not allergic, but they're reacting to it, let's say, and are stressed around it. So we can work around that, or we can say dental nosodes, and we can see what some of the issues are. Gingivitis may come up, like here. Now, fatty ostis of the jaw. So we can work through it. As I've showed you in our other lessons, we can work and train and do therapies from the main matrix. Okay, but let's go into the dental program here. From programs, we go down to dental oral muscular re-education. Oops, this I had to open before. So when you open this program, you come up here. Now, there are many programs in here that we can work, okay? I want to show you a more holistic approach and not go into the detail, because we need a lot more time than just 1 hour. So, if someone needs any extra mentoring, I'll be happy to help anybody. Just contact me about all the programs that are available here. But let's start with what we can do here. The first thing that is good to do is search for foci. Okay. This panel, this pink panel that comes up, are reactions from your whole body that come up from the teeth. Okay. And we can see immediately with one glance what is the most stressed area. Here we see whatever is the highest number. In my panel here, I see 153 TMJ. So I do have an issue. I know I have an issue with TMJ, maybe creating migraines, headaches. Those are my issues. The next one is stress. Okay, who doesn't have stress nowadays? I think I have to work on myself more. 144, also the sympathetic nervous system. I have to work. Whatever you see over 100, it just gives you an indication where you should be going throughout your entire session. Okay, so on me, I have to work on my sympathetic, parasympathetic issues, the nerval, a little bit of the sinus, a little bit of the lymph, TMJ mostly, some deficiency syndrome, toxicity, and stress. Okay, so you don't do therapy. This is just for an indication. To get this out of the way, you just click once and it goes out. And we have this panel. This panel is called the 5 functional teeth terminals and its association links. It links the teeth frequencies with the sense, the spinal, joints, mind, sinus, tonsils, endocrine. So you have an indication that according to terminals, the kidney bladder, for instance, liver gallbladder, What we look at here is what is over 100 as an acute or your low items. Me, I don't have items over 100. The highest number is 96. So, okay, whatever's over 90 is also an issue of stress, not so much as it is over 100, but it is issues. I have people though coming in and that all the items are like really high and over 100. But, I like to focus more on the acute items to help the client get over issues that they're feeling now. So what you do is you notice here, for instance, mine is here 96 on the terminal heart, small intestine, which links the tongue, C8 in the spine, T5 in these areas, shoulders and arm, sadness and joy, middle ear, has, what the connections are. We can do a treatment by double clicking. Okay, so we're entering into the therapies here. This is a more general therapy. Okay, it doesn't give us a rectification value, but that, you just tingle that area and we go on. Now, here we have 3 options. We can go into the teeth chart. I just want to show you. I won't go in it today, but whoever wants, I can mentor about this and how it works. It's a very good area where you can rectify certain infections and problematic teeth. Here's the TMJ scan where you can work specifically on TMJ areas of the whole cranial. Okay, you can scan and treat. Very effective. You immediately see the person start yawning and releasing all that stress. The dental foci is that pink panel that I showed you in the beginning. Okay, as soon as you start with this panel, the next step is going into information, because you have to go into this panel to do the next step. It's a step-by-step process. The next one item that is opened here is the test Clifford report. This gives you click it, and this scans you, and it gives you a full report on reactions around the dental area and what the main issues are in the whole body. It's a holistic approach. And here's the memo, and it gives you all the information. I love this panel. And it's really, if you go into it, it is really to the point. So here you see on the first part, some issues a person may have. Appears that I have an issue with my first molar, stomach issues and production. Okay, thyroid with these areas in my vertebrae. There's a foci in this area, in these cranium, sinus, nerve, muscles, and tonsils. True. They're caused by, you see the cause, the foci and cause, trauma, allergy, radiation, toxicity, and stress. So you can discuss these things with the client, okay? And ask them, you know, what's going on with their radiation toxicity. You can investigate it more, the toxicity through homotoxicology, let's say the allersodes. Lymphatic congestion. Okay, so we do have to open our lymph. So this is when you see something like this, you know, on piggyback, you'll have to, you know, open up your lymph, put it on the lymph area. All these issues are involved with mental factors, allergy, and stress. And it tells you what to do, what treatment you should do. Okay, it tells you. There's so much information in this Clifford report. Most possible stressed organ, temporal lobe brain. Okay, gives you some more information. So what you do with this is you go to therapies, Eductor 1, treat memo items and balance all major risk. This opens an AFE panel here for the Eductor's working panel. And you do it till you rectify over 100. So it's working on all these items. But you know, you can take a note of these items and know what else you have to do. Increase the awareness, nutritional therapy, you know, perverse energy, okay, reduction of stress. Since it said congestion, lymphatic congestion, what I would do is I would go to Body Viewer, and while this AFE is working, I would go to my Body Viewer. I would go to the lymphatics. So I definitely clear, you see, lymph degenerative. Okay, so I definitely have to open up my lymph. Okay, can discuss some other type of things that, you know, they can follow in their daily life. Since I'm here in the Body Viewer as a piggyback, there are dental areas that I can work on, the TMJ here. Good idea to work the cranium since I'm working the DMJ. Okay. You can work pain. So all these items are put on piggyback. I can toggle back to my AFE, see where I am. I'm still at 68%. So I still have time to add more piggybacks around the dental area that I'm working on. I can go to iridology. There's dental areas here as well. In miscellaneous, there is the TMA disorder. Okay, if you want, you can focus on that, do some unconscious search and activate the piggyback so it can work on the TMJ. Or there's also the dental foci tab here that you can choose. There's all sorts, I mean, you can go one by one and try to memorize everything, but I like to work always on what the unconscious tells me, what the body is telling me. So unconscious choice, and it's coming up the candida. Okay, so let's activate that one. Okay, that will help clear up the candida on piggyback. Let's go back to our AFE. So We got the rectification over 103, but I want to show you something else. Let's leave it here so we can deepen the therapy. The longer you do it, the deeper it gets into intercellular therapy. Let's go to the disease dictionary as a piggyback. Okay, there are different, there's so many things that you can do here, but around the teeth, around the teeth, there is the dental root. If you want, you can go there, dental root, or TMJ. Where is the TMJ? There it is. Okay, and there's also the toothache. Okay, so, you can do one of these and, let it run as a piggyback. Okay, let's see, out of curiosity, how many minutes it's going to choose for me. So it chose in the toothache 24 minutes. Okay, so I like to always respect what comes up. I do a long-term therapy active and auto treat. Okay, so there I have my piggybacks running around my teeth. Now, I don't want to forget anything that I'm telling you. Okay, so I still have more time here. I just want to show you other things that you can do here in the therapies. You can follow up the how to remove amalgams. There's specific therapies here showing you what are the issues, which amalgams should be removed first, second, third, fourth, and in what order. Okay. Beautiful therapies for the dental. Let me show you again from here, the teeth chart, since we have time. I had passed this. When you first do this, there's no reactivities numbers. I had already passed through it to see something, how it was working. So you can choose between either infection, inflammation, degeneration, toxicity, mechanical stress. By choosing it, you focus on what you want to test, where the infection is, for instance, where the inflammation is, where the degeneration is, where the toxicity is, or where the mechanical stress is. You can either choose 1, 2, 3, or all of them. And by choosing them, you focus on those areas. Okay. Again, it's the same logic. Whatever is over 100 is a stressed area. Because, as I said in the beginning, the jaw and the mouth is the most stressed area and tense area of the body, creating all other problems. Obviously, the stress will be focused. I've rarely seen people not having numbers over 100. Like you see me, I have the back ones because I do have TMJ are over 200, and the front teeth are in the 100 areas. So, you can work on them, test and treat the whole area till you get a good rectification. Or you can even click on specific teeth and going around and treating them. A fantastic program as well. Now, I want to show you other places in the program, in the pulsar, that you can work at the dental areas. Here in the auto zap, we have auto-zap cavities. We have auto-zap dental disease and dental sarcodes. We have auto-zap gingivitis. Okay. And another good area, again, to work around the teeth is the bacteria. Okay, for the auto-zap. You know, it's always wise if you know someone is going to have, going to the dentist and going to have work done in their mouth, surgery or whatever, it's always good to tell your clients to do a prep 1 to 3 sessions before they do any work on their teeth, and then a post 1 to 3 sessions after they've done the dental work. Okay, this will give better results on what they will be doing with the dentist, but also it helps with any, let's say, complications that they may have nervally or infection spreading, etc. Their results with any work they do on their teeth will always be better if they do pre and post therapies. Now I have another tidbit to show you through the universal therapies, what you can do. Now, I don't know if you know, many may know, but some beginners may not know, you can work on Rife frequencies through the universal therapies. And by working through Rife, you work very high frequency and you go to an intercellular penetration, and it goes really deep into the organs and cells, whatever you do. You can get on the internet all the Rife frequencies, depending on what you want to work. I'll give you some right now for around the dental area. So what we do, general practice when we're working with Rife, here in the scale generator, we'll put 24 million, 24, 1, 2, 3, 1, 2, 3. Okay. On the upper and lower, same number. Here we amplify to 33. Okay. And we put on intermittent. And we set the program number at 120. So that's by default, you put these numbers here and you check off. And some numbers that you can put, for instance, for general dental health as a Rife 1043, you can use. So if you use that, you then put the timer, let's say you want 1 minute, 3 minutes, however many minutes you want, and you press start. 1043 is for dental problems in general. Some for infected gums, you can go for 960. You put Rife, the same number on the top and bottom, making it strong. 960 or 660. These are general Rife frequencies for gum infections. 690 is also a number. There's so many numbers you can use. And there you can find the book, the handbook of the Rife frequencies on the net. Okay. 690, 190 is another number that you can use. And it makes it, you know, really, you put 3 minutes, you could put 5 minutes, whatever, and you put start. You'll have your percentage of success here. So depending on your percentage of success, you'll continue. Okay, you can add more holographic, hololinguistic therapy while you're doing your Rife therapy. Here you can put, let's say, gingivitis if you have, or TMJ, you know, whatever, organ relation, you know, dental, emotional blockage, depending on what came up NLP or what comes up in your Clifford report that you did previously. You can, put stress in general, anxiety, etc., add the Schumann weight. And again, since you've loaded everything, you start the therapy and it goes really deep. Okay, you get very good results when you work like this, and working with the Rife as well, wherever you can. So around the dental area, that's around what I have to say. I don't have much more to say around that, but just to say that it's very, very important to work around. Let me go back and see if you have any questions, so I can go deeper if you wish. Let me see. Who's on with us today? Nikos from Thessaloniki. Hello, hello. Nadia, Enescu, Lotte, Emilia, London. Good evening to everybody. Please ask me questions if you have any patients you're dealing with TMJ. So important to work the whole cranial and that area. Let me show you the TMJ scan as well, since we had time. So here in Universal, we have the option of going also from here to dental, okay? Even in the spinal area, you have options of going into the dental directly. Okay, see, we've done the Clifford report. It's still, it stays with us, so we have all our information whenever you want to refer back to it. So going into the TMJ, by scanning and treating, let me show you. It scans and treats. You can go, and it's showing us where the issue is right here. As it rectifies, it goes to other foci places. It's showing us where it's working. Down here. You know, and when someone's in pain, I like, after I do our regular startup that I usually do with everybody, going directly into the dental, then going into the blood and working down the spine. So you're starting from the top and working downwards, and you get great results that way. Their pain immediately starts leaving. People with hip pains, knee pains, as I said in the beginning, all start up here. Okay, so as you can see, we have the progress bar. It finished. It worked on specific areas that it felt that it needed to work. Okay, so you can go on each tab and work the same way. Now it's working again on the side here. Yeah, because usually from my TMJ and my headaches, they start right here behind that side too, behind the eye. The doctor is so smart. Remember, it has that artificial intelligence. It knows. Okay, so we have everything working. See, it's going to specific areas. And just by doing this, each one, it relieves the tension. It's really, really fantastic. Okay, one by one, you can do it. Now, another place in the program that you can work, again, is in the spinal, the dental area. After you finish with all the dental area, it's always good to do the spinal because, it's that whole communication downwards. When you go to cranial sacral, you notice that the first one here is the TMJ therapy. When you do this therapy, the items that are less of an issue, obviously, gray out quicker. The items that are more of an issue stay there, and you have to repeat it and repeat it. So when you notice that TMJ up here is an issue, and it's grayed out last, let's say, or later on, you definitely should go into the dental therapy and do TMJ and relieve that stress from the person. Because remember, as I said in the beginning, TMJ is the imposter disease, and it appears in various forms of pain or issues. I mean, even digestive issues. Okay, you see, it's not being grayed out for me because I know TMJ is an issue. When people go to the dentist, and the only therapy that they usually give is giving them a brace to wear at nighttime so that they don't clench their teeth while they're asleep. So most people don't go into that path of wearing their brace, etc. What I usually tell people, so we test this again. What I usually tell people is, apart from the therapies that we do, try to get into the habit of putting their tongue on the roof of their mouth. It doesn't show, and that way they don't clench their jaw. While they're driving, while they're reading, while they're working, while they're sleeping, just put their tongue on the roof, and that's their natural brace, you see? And they don't need to wear the brace that the dentists give for such situations. You see here? When issues like this come up, TMJ is the last one to be grayed out. So we could do it over and over again. Here, I don't know if you know, I mean, there's an entire library within the software. On the right side, if you click on these are PDF files that you can read about in depth about each situation, and you can download them. Okay, so I won't stay here any longer, but you get the gist. You stay here till everything is grayed out. But if you see that the TMJ therapy is not grayed out and it takes longer to grade out, you definitely have to go into the dental area to work on. So here in the spinal area, in the time therapies, again, there is the dental here. I remember it's here. Let me find it. don't see it, but anyhow, I thought I remembered seeing it. But the reticular formation is coming up, nervals, pulse, and the lymphatic congestion. Remember, we saw it in the Clifford report. Reticular formation, that's the Wi-Fi. That's right here. And that is, of course, affected by the jaw. Okay, it's the stress, that the top of the neck here. Okay. So that is about it around the dental. Let me see if you have any questions. Any more questions? Please tell me. I'm here to answer any questions. Feel free. Well, so if you want to message me in private, or you want any additional mentorship, you can feel free to contact me. I would love to hear you. I hope this was really helpful. I know it wasn't in depth, but these are little secrets that we have. This whole thing is kind of complex. Oh, Beatrice, tell me, how can I, did I confuse you? You want me to do it one more time? Let me show you again then. Okay, I'll go back and show again. Or you can always look again at the video. No questions. Okay then. Okay, I don't. Okay, Beatrice. Okay, so yeah. If you start working with a dental, it'll clear up with you. It's not that confusing. It's you'll get the information. Let me show you again. Maybe explain it more, so I can explain it more to you. When we go into dental, the first thing that opens is our panel. Okay, so the first thing that we have to do is we search for the foci. And as I said, the energetic dental foci risk is just information to show us what is more stressed in our body, whatever is over 100. We have a first glimpse of what are issues. Some people, let's say, their highest issues are hormones. Other people have circulatory issues. My issues are around TMJ, sinuses. I have my allergies in the sinuses. Didn't know I have motor issues, but okay. Maybe I should work on that. Sympathetic, parasympathetic, I should work on that, and deficiency syndrome, toxicity, and stress. So this is just informative that I need to investigate more around the program. Okay. But it gives you a first indication of what issues there are and what their top priorities are. In this 5 functional terminal area, it's a table showing the interconnection of specific teeth with the specific endocrine area, spinal area, the sense, the organ. Okay, specific teeth. These are specific numbers of teeth. These numbers of teeth you can see from teeth tables. You can find on the internet a lot of teeth tables. So you'll see which teeth are connected with which areas of the body. This is it. So you can do therapies on whatever is over 100. You can do therapies on all of it as a tingle. Okay, just double click and it's doing a therapy on this terminal for me, for the heart, my heart, and the small intestine terminal. Okay. After that, when you do that, the test Clifford report opens because it was grayed out before. It opens, you can do it, and this information comes out, the memo, that you see the problems, where the foci is, what the cause of the issues are, what it involves, how I can treat them, okay, what the most stressed organ is, okay, and some more information down here. And what you do, you go to the therapies and Eductor 1, treat memo items and balance all major risks. As I said before, it was AFE program to do therapy on all those items. Okay, that is the basic holistic approach. When I do this, even people who have gingivitis, periodontitis, even, dental sacs, like tooth sockets, like even cysts, doing this even once, and they go to the dentist, they see a difference. The cysts get smaller. It's a very strong program, and it's really good to use. Okay, it solves a lot of the issues just by doing it. People have come with major problems, and each time they get better and better, and they come like once a month. It doesn't need, a lot of therapies, one on top of the other, but they see the difference. Okay. The other therapies on this panel are more specific, working on the teeth, working on removing amalgam, but that I think is more for, we can do mentorship for that because they're really in detail. This is the more holistic approach. Now here also in the therapy drop down, we have 4 AFE therapies: nerval repair, pain reduction, trauma repair, and balance the muscles, here in the face. Remember what I said in the beginning. These muscles are interconnected with all the muscles, the nerves, and the vertebrae throughout the whole body. So it's very important working the entire jaw and cranial area. Okay, so as I said, these are AFE programs. Okay. Yeah. Let's see. Any more questions? Okay. I know there's a lot of information, but our videos are up there. You can see it 1 or 2 times, and I'm free. Just message me anytime you want on my messenger. I'm happy to help you if you have any questions. Thank you so much for joining us today. Thank you so much. I'm happy to be always of help for you. I'm sending you love and kisses and always good health to everybody. Bye.